come here today at a very important time in our nation's history. One of the things that we have seen is the impact that COVID-19 and the racial injustice that has plagued this nation for many years, the impact that it has had, particularly on communities of color. We have failed to address the systemic nature of the challenge of health equity for all. Many of the attempts at solving this problem have been episodic, but we come together, the Morehouse School of Medicine and CommonSpirit Health, to say that what we have done in the past, unfortunately, has not worked. And we believe that the architecture in the pathway that together we are setting forward will, in a systemic way, begin to address a challenge that we know has to be addressed.
Today, we are here to announce the first nationwide partnership between two of the country's leading health organizations, CommonSpirit Health and Morehouse School of Medicine. We will go on a 10-year journey of an $100 million initiative. When we think about what this nationwide partnership would be with CommonSpirit Health, we will take the Morehouse School of Medicine's brand and model, and we will develop 5 regional medical school campuses across the nation, thereby doubling the number of students who are admitted to Morehouse School of Medicine and who will graduate from Morehouse School of Medicine. And at 5 of those campuses, they will have the CommonSpirit Health touch. We also will expand our graduate medical education. As you know, out of the 120,000 or so residents in training in this country, less than 4.9% of them are African American. That has to change. Our partnership with CommonSpirit will allow for us to identify 10 regions in the CommonSpirit Health Network. And with that, we will expand graduate medical education with 2 to 3 residency training programs at each site. So imagine tripling the number of graduate medical residents that will move out into the community as fully competent providers, culturally competent providers, over the next 5 to 7 years.
This partnership is going to ensure that we dramatically increase the number of physicians of color and the number of clinicians of color in communities all across this nation. One of the things that we have learned is that patients do better clinically and have better medical outcomes when they have access to clinicians and physicians in particular that represent their demographic. And we know that community members, we know that patients have told us over and over again that it is important to them to see a clinician, to see a physician that looks like them, that understands them.
The way we educate and train our students in a culturally competent manner is going to allow us to enhance one of the most trusted relationships, and that is between the patient and the provider. And so we are excited about being able to measure every year more students being enrolled in medical school who are underrepresented in medicine, more students being enrolled in our graduate medical education program, and then, of course, the number of persons who walk across the stage after medical school, and then the number of physicians who go out into those communities after they finish their residency training. That's the impact that we're hoping to see, that we know we're going to see with this wonderful partnership between Morehouse School of Medicine and CommonSpirit Health.